Lifestyle is critically important for liver health because the liver is a central organ in the body's metabolic processes. It is responsible for a wide range of functions, including detoxification, metabolism of nutrients, regulation of blood sugar levels, synthesis of essential proteins, and storage of vital nutrients. Here's a couple ways. Number 1. Practice safe sex and avoid sharing needles. Practicing safe sex and avoiding sharing needles are essential measures for safeguarding liver health. These behaviors directly pertain to preventing the transmission of blood-borne infections, particularly hepatitis B and C. Both viruses can be transmitted through contact with infected blood, which can occur during unprotected sexual intercourse or through the sharing of needles or other drug paraphernalia. Using barrier methods such as condoms consistently and correctly during sexual activity greatly reduces the risk of transmitting or contracting hepatitis B and C. This protective measure is not only crucial for liver health but also for overall sexual health and the prevention of other sexually transmitted infections. Additionally, avoiding the sharing of needles for drug use is paramount. Contaminated needles can serve as a direct route for the transmission of hepatitis B and C, as well as other blood-borne infections like HIV. Utilizing sterile needles and practicing harm reduction strategies, such as needle exchange programs, significantly mitigates the risk associated with injecting drugs. These measures not only protect individuals from the immediate risks of infection but also play a crucial role in long-term liver health. Education, access to prevention resources, and destigmatization of these practices are key components of promoting safe sex and harm reduction strategies. These efforts contribute not only to individual well-being but also to the broader public health goal of reducing the incidence of hepatitis and other blood-borne infections. Number 2. Practice good hygiene. Maintaining good hygiene practices is a vital aspect of liver health. Proper hand washing, in particular, is a fundamental measure for preventing the spread of infections, including those that can affect the liver. Hepatitis A, a highly contagious virus, is primarily transmitted through the ingestion of contaminated food or water. By diligently washing hands with soap and water after using the restroom, before preparing or consuming food, and after contact with potentially contaminated surfaces, individuals can significantly reduce the risk of contracting and spreading this virus. Additionally, practicing good hygiene extends to food handling and preparation. Ensuring that food is properly cooked and stored, and that surfaces and utensils are thoroughly cleaned, helps prevent the transmission of pathogens that can lead to foodborne illnesses, including those affecting the liver. This is particularly important for individuals with pre-existing liver conditions or compromised immune systems, who may be more susceptible to the effects of foodborne infections. Maintaining a clean and sanitary living environment also contributes to overall health and well-being. Regular cleaning of living spaces, especially in shared or communal settings, can help reduce the risk of exposure to infectious agents. This is particularly important in settings like healthcare facilities, where vulnerable individuals may be at higher risk of complications from infections. Overall, good hygiene practices are integral to preventing the spread of infections that can affect liver health. They form a critical line of defense against the transmission of pathogens, particularly those responsible for hepatitis A and other foodborne illnesses. By incorporating these habits into daily routines, individuals can take proactive steps to protect their own health and the health of their communities. Number 3. Manage chronic conditions. Effectively managing chronic conditions like diabetes, high blood pressure, and high cholesterol is paramount for maintaining liver health. These conditions are closely interconnected with metabolic processes that directly impact the liver's function. For instance, diabetes can lead to elevated blood sugar levels, which constrain the liver's ability to regulate glucose effectively. High blood pressure can affect blood flow to the liver, potentially impacting its metabolic activities. High cholesterol levels can contribute to the accumulation of fatty deposits in liver cells, potentially leading to conditions like non-alcoholic fatty liver disease, NAFLD. Regular monitoring and management of these conditions through medication, lifestyle modifications, and healthcare provider guidance are essential. Adhering to prescribed medications and treatment plans, maintaining a balanced diet, engaging in regular physical activity, and attending routine medical checkups are key components of effective management. By proactively addressing these chronic conditions, individuals can significantly support liver health and reduce the risk of associated complications. Number 4. Avoid exposure to harmful chemicals. Limiting exposure to harmful chemicals and toxins in both the home and workplace is crucial for safeguarding liver health. Certain chemicals and substances, when inhaled or absorbed through the skin, can exert stress on the liver's detoxification processes. This includes household cleaning products, pesticides, and industrial chemicals. Individuals should use these substances in well-ventilated areas, wear protective equipment when necessary, and follow usage instructions carefully to minimize potential harm. In occupational settings, employers should provide appropriate training and protective measures for workers who may be exposed to potentially hazardous chemicals. This includes proper ventilation systems, personal protective equipment, and regular health monitoring. Additionally, regulatory agencies play a crucial role in setting and enforcing safety standards to protect workers from harmful exposures. By being mindful of potential sources of chemical exposure and taking appropriate precautions, individuals can help reduce the burden on the liver and promote overall health and well-being. This includes advocating for safer practices in workplaces and supporting policies that prioritize environmental and occupational safety. Number 5. Get vaccinated. Ensuring that individuals are up to date on vaccinations for hepatitis A and B is a proactive step in protecting liver health. These vaccines are highly effective in preventing infection by the respective viruses, which can lead to serious liver-related complications. The hepatitis A vaccine provides immunity against the hepatitis A virus, which is primarily transmitted through contaminated food or water. By receiving this vaccine, individuals build immunity against the virus, reducing their risk of infection. This is particularly important for travelers to regions with higher rates of hepatitis A, as well as for individuals living in communities where outbreaks may occur. The hepatitis B vaccine is crucial for preventing the transmission of the hepatitis B virus, which can be spread through contact with infected blood or bodily fluids. This includes activities like unprotected sex, sharing needles, or from an infected mother to her newborn during childbirth. Timely vaccination can offer long-lasting protection against this potentially severe infection. Moreover, for individuals at higher risk due to their occupation or lifestyle, such as healthcare workers, those in close contact with individuals with hepatitis B, or individuals who engage in behaviors associated with higher risk of infection, vaccination is especially important. These individuals should consult their healthcare provider to determine the most appropriate vaccination schedule. By ensuring that individuals are vaccinated against hepatitis A and B, communities can significantly reduce the incidence of these infections and the potential burden they place on liver health. Advocating for vaccination programs and ensuring access to vaccines are crucial steps in protecting public health and liver health in particular. If you've enjoyed this video and helped you learn more about liver health, please be sure to subscribe to our channel and click the notification bell so that each week we release a brand new, life-saving video, you'll get notified right away.